Hypertension is a major public health challenge affecting populations from both economically developed and developing countries globally. The disease remains a major risk factor for the development of cardiovascular diseases, which is responsible for over 17 million deaths worldwide in the year 2015. The highest prevalence of hypertension in the world occurs in the sub-Saharan Africa, where many patients of hypertension end up with strokes and myocardial infarctions. Hence, the disease is described as a silent killer. The Kintampo Health Research Center in the year 2015 embarked on a community-based study to understand the prevalence of hypertension within the Kintampo North and South districts. Solomon Nyame is the implementation coordinator for the hypertension control study.
What happened was that in 2015, we wanted to understand the prevalence of hypertension within our setting. So what we did was that we spoke to about 2,500 participants within Kintampo North and South to help us understand the prevalence and other related information regarding hypertension and its related issues. So that's what informed our decision. So we used a standardized questionnaire, which is the WHO stepwise questionnaire, where we asked key questions about lifestyle, we asked questions about medication use, we asked questions about demographic questions and other, but we also collected some blood samples to do analysis for comorbidity.
The survey, amongst other things, revealed that the overall prevalence of hypertension stands around 25%, with more than half of the hypertensives not knowing their statuses.
The outcome, which has been published online, talks about the fact that we found the prevalence of hypertension to be around 25%. What it means is that when you take every 4 adults, one of them has hypertension. And then also what we also found was that out of those who were hypertensive, majority of them didn't know about their status. What it means then is that they are not really seeking care. And for those who knew about hypertension, I'm afraid to say that some of them are also, about half of them are not also seeking the needed care at the facilities. And that meant that there is a lot of people walking around with hypertension who are not really seeking care.
Again, in terms of gender disparities, the male subject had a significantly higher prevalence of prehypertension and stage 1 hypertension compared with female subjects.
We found that majority of the participants we interviewed were females. However, those with hypertension tilted towards the male sex. And what it means is that, because of a lot of factors, for instance, we know that when it comes to the intake of alcohol, the male sex dominates. And also another thing that came out of in terms of gender, was that majority of the women were seeking care. However, when it comes to the men, about 15% of them were, at the time of the survey, seeking the needed care.
Solomon Nyame, however, admonishes Ghanaians to endeavor in seeking to know their statuses to ensure that they get the needed care on time.
The Ghana Health Service is putting in a lot of intervention for people to check their BP. This is not just for hypertensive patients. What we are trying to say is that if you are 18 years and above, and I'm stressing on 18 years and above because we previously thought that hypertension was for people who were, let's say, 40 years and above. But what you are realizing nowadays is that people below 40 years, even below 80 years, adolescents are having hypertension. So when you go to the health clinic or whatever facility you find yourself, there are opportunities for you to check your BP, know your status, and whatever intervention the health system gives to you, try and adhere to it so that you don't get the complications which leads to death and all the other issues.
The study showed that 1/4 of adults in the middle belt of Ghana had hypertension, with less than half of them being aware of their statuses. Anas Sabit, Joy News, Kintampo.